Greetings, beloved audience, welcome to my channel. Presently we shall deliberate on an exceedingly pertinent subject, namely comprehending, or more precisely ascertaining, identifying a cardiac arrest. What is it? What are the potential threats it can pose? Most importantly, how can it be prevented? And what are the available methods for its cure? So what is a heart attack? In actuality, a heart attack is such a well-known name, if you can phrase it like that. It is more accurate to state myocardial infarction. Although myocardial infarction is also well known to many, a large number of people are familiar with or have come across this concept in one way or another. What is a myocardial infarction? Otherwise it is called a heart attack, or in other words, a cardiac arrest. The essence of this disease is that one of the vessels of the heart, the so-called coronary arteries, is completely or partially blocked by a thrombus or an atherosclerotic plaque, as a result of which a part of the heart ceases to be supplied with blood. All of this leads to the fact that a portion of the heart starts to die, and the more this process persists, the more severe the consequences can potentially be. The outcome hinges on the affected artery, its diameter, and location. The emergence of this cork plays a pivotal role, as it largely dictates the subsequent course of the disease. But one way or another, a heart attack will be equated to the word myocardial infarction. So, how can you ultimately determine whether you are experiencing a heart attack or if it is simply intercostal neuralgia? Indeed, after numerous years of working with patients who have had a heart attack, individuals who have experienced a heart attack, I can confidently say that in most cases, in reality, when it comes to a heart attack, the main symptom is of course chest pain. As a general rule, pain is burdensome. It can be extremely intense, pressing, and squeezing. Patients frequently express that it feels as though you have placed a hot plate on their chest. Pain can also be radiating, indicating that it can spread to the left hand, shoulder blade, back, right hand, but usually predominantly to the left side, extending towards the lower jaw area in most cases and involving the surrounding tissues. Now we'll discuss the main symptoms. It's clear there can be many more, but I'll tell you the most frequently encountered one. And typically the pain is quite intense, as is usually the case with this type of condition. On many occasions, they have an unbearable character, so frequently both emergency assistance and specialized cardiological hospitals resort to the use of what are known as narcotic analgesics. That is, they employ drugs to relieve pain in the patient, because the pain can be truly very strong and require immediate attention and relief to ensure the well-being of the individual. The second common symptom is, of course, shortness of breath. It can be accompanied by both pain and can be a separate symptom. It can occur suddenly. It is a sensation of breathlessness. The third indication is the display of elevated body temperature. That is, an individual's body temperature may increase and they may experience a so-called cold, sticky sweat. This is an extremely characteristic symptom when an individual suddenly experiences a blockage of this heart vessel. They become covered in this cold and sticky sweat. It is actually unmistakable. Patients describe it very clearly, and it is very well visible clinically, so a doctor can also easily recognize it and make a prompt diagnosis based on these distinct clinical manifestations. The following symptoms, they are already less common, but they also occur, so I also want to mention them. This is obviously nausea or vomiting, which also occurs quite frequently. I would also like to mention that there is an overall weakness. Headaches may potentially occur. In fact, the list of symptoms is very broad. There are even such concepts as cerebral forms of infarction, that is, when they manifest, for example, only with headaches. For example, there is an osmotic type, that is, when it manifests directly as shortness of breath, a feeling of lack of air. There is a type of myocardial infarction called abdominal type, which presents as gastrointestinal symptoms such as nausea, vomiting, and even diarrhea. In reality, there exist numerous varieties, but the most common one is probably the pain experienced in the chest, which is quite intensive and often radiates to the left hand and jaw area. This is shortness of breath, this is pronounced general weakness, sudden, and the separation of this cold, sticky sweat. Possibly these are the most frequently observed indications of this cardiac arrest. If you have observed these symptoms in yourself or in your close relatives or family members, I highly recommend that you immediately contact an ambulance and request the assistance of an ambulance crew without any delay or hesitation. You don't need to do anything on your own. The only thing you can probably do, if you have aspirin in your medicine cabinet, for example, is to take half a tablet of aspirin, 250 milligrams. If, for instance, the pressure has increased, you can measure the pressure. If you have high blood pressure, you can take either nitroglycerin under the tongue or a tablet, for instance, captopril, which will allow you to lower the pressure and reduce the risk of complications. This is likely the most you can do. Take a comfortable body position in which maybe the pain is not as intense and wait for the arrival of an ambulance. It is strongly not recommended to go out of the house, let alone use public transportation on your own. Furthermore, it is not only that, but it can also lead to undesirable outcomes that should not be taken lightly. Please wait for immediate assistance. They will perform a cardiogram to diagnose and address this problem. After that, they should prescribe you special medications that will temporarily relieve your condition. Furthermore, they will make arrangements for you to be transferred to specialized institutions for coronary angiography, if it is possible in your region, of course. Your health and well-being are their top priorities. If there is none, it is more reasonable, of course, to perform thrombolysis. That is, this drug is also administered intravenously, which precisely dissolves these clots. If you are interested in this topic, you can also ask your own questions, and we will try to answer them. To summarize, I would like to state that a heart attack, also known as a myocardial infarction, is an extremely serious condition that frequently results in fatal consequences, meaning that an individual can lose their life, or to endure a heart attack, and after that, his quality of life will also be significantly affected. Here is such a small, informative video. Ask your questions, leave comments, and most importantly, stay healthy.